One of the biggest worries for mums-to-be is not only their own health during pregnancy, but also how that affects the well-being of their unborn child. The route to motherhood throws up many health issues for women, from morning sickness to high blood pressure. So here today to offer advice on combating all manner of ailments and hopefully putting your mind at rest is Dr. Dawn Harper and Amanda Butler, who suffered with a far more common infection than you may think during her pregnancy. Welcome to both of you. So, Dr. Dawn, let's start with you. During pregnancy, the body goes through hundreds, if not thousands, of big and small changes, but it's nothing to be alarmed about, right?
No, I mean, obviously there are some changes which are very obvious and easily explained. Your tummy's going to get bigger, your boobs are going to get sorer and so on. I think the important thing is that, the minute you start thinking about wanting a baby and certainly the moment you get that positive pregnancy test, your health becomes very important to you, not just because of you, but also obviously because of your unborn baby. And what I would say is that if there are so many changes going on, and if you are unsure, if it's not obvious why, then you must ask your midwife or your GP, because Amanda's story I think says it all really.
Yeah, let's get to that actually. Can you tell us a bit about your experience?
When I was pregnant with my first son, I went into premature labour at 25 weeks. I had him at 25 weeks. He was £1.9 ounces. I was told at the time it was an incompetent cervix. So when I got pregnant again with my second son, I was obviously quite worried about how this pregnancy would go. I saw a new consultant and she told me that it wasn't an incompetent cervix, it was probably more than likely BV, bacterial vaginosis, which is a common infection that's easily treatable. So it was a bit of a shock to find that out after spending so long thinking that it was my cervix that was a problem and not an infection. My consultant sort of looked after me, made sure that I was treated when I did get it again, and I had my second baby at term, and he's fine. My first baby is fine as well, after being born so prematurely. But,
yes. Callum, boisterous 2-year-old,
yes.
you were saying earlier on,
Yes.
which is great to hear, and congratulations
Thank
on your
you.
second beautiful baby as well. Looking back, you were saying you did have symptoms that actually in hindsight you wish you'd got checked out.
Absolutely. I had a change in discharge, but when you're pregnant you do get different discharges, so I didn't think anything of it. I also didn't want to sort of go to my midwife unnecessarily, because I didn't think anything of it. As I said, I thought it was just a discharge, and then I thought, maybe I'm just weighing myself a little bit, which sometimes happens when you get pregnant. In hindsight, I wish I'd gone to see the midwife earlier, because they could have done something to stop me going into labour.
But this must be commonplace, Dr. Dawn. People all the time must be thinking, is this me overreacting? It's certainly for your first pregnancies.
Yeah, absolutely. But bacterial vaginosis is incredibly common. It's actually twice as common as thrush. And yet most women, and I'm sure you would have been the same, never heard of it until they've had their first diagnosis. 1 in 3 women will get it. Now the problem is, if you get it in pregnancy, it can sometimes cause premature labour. And you mentioned one thing, you said you thought maybe you were weeing yourself. And I think actually that's often a little bit of an alarm bell to me. Yes, women do wee themselves when they're pregnant, but what that suggests is your discharge had a little bit of an odour. And the classic difference between BV and thrush is odour. In fact, Balance Active do a symptom checker on their website that you can look at, but the big one for me is odour. And if there's a slightly fishy smell to your discharge, it could be BV and it shouldn't be ignored. But whatever, if you've got a changing discharge, I think often we don't like worrying people, do we? Don't like bothering the midwife, bothering the GP, but you know what? That's what we're here for, to be bothered. So, thank goodness that everything turned out fine, but it could have been quite a different story.
Yeah. So for people who actually are going, let's say their first pregnancies, just for an example, they're suffering morning sickness, all things that could be on your pregnancy checklist, but they are worried, what would your advice be?
Oh, if you're worried, if you don't think this is quite right, and how can you tell in your first pregnancy? It's difficult, but usually with your first pregnancy test, you buy your first pregnancy book, I think, too, don't you? And you read up madly. If you don't seem to be fitting into those symptoms, if it's not quite right, and if you're worried, ask the question. It might be that it is actually completely normal, and your midwife or your GP can put your mind at rest. But it may be that it's something simple like BV that's very easily treated, or it could be something more significant, so it's important not to ignore it.
Absolutely. Thank you so much, you both. We're out of time. If you would like further information on BV, then please go along to the website balanceactive.com, and I'll see you next time. Bye-bye.